If Medicare covers your wound care, a major 2026 rule change is about to affect you. The headline number? Medicare plans to slash spending on a key category of advanced wound care products by nearly 90%. Why? Because spending on these products exploded from $252 million to over $10 billion in just 5 years. To control this, Medicare is overhauling payments, moving from market prices to a new flat rate. We'll break down what's changing, why it's happening, and the potential risks for senior care. The changes focus on cellular and tissue-based products, or CTPs, also called skin substitutes for treating chronic wounds. The new rules take effect January 1, 2026. This isn't a small test, it's a nationwide policy change. All 7 Medicare contractors will adopt the same rules, creating one national standard for coverage. The new system is built on 2 pillars: strong clinical evidence and complete documentation from doctors. Only skin substitutes with peer-reviewed studies proving they work will be covered. Some products will lose coverage. Medicare has been clear. Documentation is the key safeguard. Providers must prove every application is necessary. Now that we know what is changing, let's look at the critical question. Why is this happening? It's about money. In 2019, Medicare spent $252 million on these products. By 2024, that number was projected to exceed $10 billion. CMS cited dramatic spending increases and high launch prices, blaming the situation in part on industry profiteering. The old system based on price is gone. A new flat rate of 127.28 cents per square centimeter removes the profit motive. This new model aims to save billions. But what will a 90% pay cut mean for the companies making these treatments? CMS states these savings can be achieved without compromising patient access or quality of care. They expect the market to adapt. Beyond the money, the rules change how doctors must approach care. Let's look at the new clinical hurdles. The vague failure to respond standard is gone. Now, a wound must fail a 50% size reduction test in 4 weeks. Before applying a CTP to a leg wound, a vascular assessment is now mandatory to ensure adequate blood flow. Products are already being re-evaluated. Oasis Tri-Layer is out, while Kerecis and NewShield are in for specific uses. The takeaway is clear. The path to using these products is narrower and requires more justification than ever before. So how will providers survive? Many industry groups are sounding the alarm, saying CMS's optimism is misplaced. Experts warn these changes could severely reduce seniors' access, leading to more infections, amputations, and deaths. A manufacturer coalition echoes this, warning the low flat rate payment could force companies out of the market entirely. So we have a major conflict. Medicare stopping runaway spending versus the fear that these cuts go too far and will harm patients. One related change is expanded telehealth access. This could help with monitoring, but doesn't solve the reimbursement issue. Let's connect this. That 90% spending cut isn't just a number. It's the direct cause for the fears of increased amputations. The new demand for peer-reviewed evidence isn't just about science. It's a tool that justifies the new, lower flat rate payment. For providers, the 2026 reality is a pincer movement. Stricter clinical rules on one side and lower pay on the other. This is a complex balancing act with high stakes. So what does this mean for you, as a patient, caregiver, or provider? To recap: 1. A massive financial overhaul is coming. 2. Care rules are stricter. 3. There is real concern for patient access. If you're a senior with a chronic wound, talk to your doctor now about your treatment plan for 2026. For providers, audit your documentation practices now. Ensure your teams are ready for the new clinical thresholds. The 2026 Medicare changes are a huge shift. Being prepared will be vital for protecting the health of millions of seniors.